Hello, everybody. Thanks for coming to our presentation. My name is Nicolas Francone.
And I'm Jonathan Ahlo.
We're both medical students at Northwestern University, taking a year off to do some research at the Center for Health Equity Transformation with Dr. Melissa Simon. The title of our presentation is Addressing Racial Disparities in Perinatal Care for African American and Black Individuals in the Chicago Community Health Setting. As we're aware, non-Hispanic Black women are 3 to 4 times more likely to die from pregnancy-related causes than non-Hispanic white women, disparity which may be higher in Illinois. African American and Black individuals are less likely to receive care in the first trimester, and the majority of high-risk pregnancy patients receiving less than 80% of the components recommended for their needs, including depression screening, referral to case management, and referral to WIC. We know that a large part of these disparities are due to the barriers imposed by systemic, structural, and psychosocial factors, including structural racism. Patient navigation role, which is community-based advocacy program where the patient advocates help patients communicate with the healthcare providers, has been shown to increase visit adherence as well as address social determinants of health needs, such as financial and health insurance, food insecurity, inadequate housing, transportation, and violence. And all of this is important because 60% of pregnancy-related deaths are preventable. In partnering with Access and Alliance Chicago Community Health Networks, the Center for Health Equity Transformation is in year 2 of 5 of the Optimize study which seeks to reduce perinatal morbidity and mortality in African American and Black individuals by standardizing perinatal care with patient navigation support, with a focus on social determinants of health. We're currently in the planning stage with the ultimate goal of evaluating the effectiveness of this intervention. And this is a constant iterative process by which we take into consideration many of the factors and advice from our community partners, providers, and patients. We'd like to share some of the challenges in developing and implementing a pragmatic trial such as this one, where the optimized intervention can be compared to standard of care via clinic randomization. Variability of the 11 clinics enrolled, such as location, patient population, staffing, and motivation of the clinics, poses a problem for outcomes being related to clinic characteristics instead of the intervention. Our solution is randomizing clinics based on the similar readiness to change scores, as well as recognizing the value of a pragmatic trial and its ability to be generalizable to a wide variety of clinics, because the goal of this intervention is to work in the real clinical world with all the challenges that brings.
So delving into the intervention is composed of 2 parts, the optimized checklist and the patient navigator role. The checklist is a digital record that includes ACOG's recommendations for prenatal and postpartum visits as they currently stand. Importantly, what we're adding is the social determinants of health screen to ensure it is done throughout pregnancy and postpartum period. And the patient navigator role plays an important part in this. So that role is chosen by the clinic to meet with patient and the review checklist throughout the pregnancy and postpartum period. A challenge with all of this is that the background profession of the patient navigator, because they are chosen by the clinics, may have more training in addressing topics of pregnancy. In order to address this, we are ensuring that the patient navigator checklist does not include discussions of medical topics and remains appropriate for non-nurse level patient navigators. Moving on to the integration, our goal is to integrate the optimized checklist into the electronic medical record to achieve a standardized, simple documentation process and incorporate patient navigator role into clinics' pre-existing workflows. We have a challenge with this because both of our partners, Access and Alliance Chicago, have 2 different EMRs. What we're doing is collaborating between Northwestern University research team and both of our partners to make sure that we find the similarities and commonalities between EMRs to make sure that optimized checklists can be accessible and generalizable to all EMRs. So in conclusion, our goal is to refine the optimized intervention in order to reduce perinatal morbidity and mortality in African American and Black individuals. And to date, we have conducted 17 stakeholder and 4 patient interviews to refine the optimized intervention with the goal of implementing this next year. Thank you.